My name is Jackie Lewis. I've been working with clients in the therapeutic setting for just over 16 years. I specialize in the anxiety related disorders while also working with depression, grief, and major life transitions. I work with adult and adolescent population having experience in school-based settings and the private practice setting. Working with the anxiety related disorders such as OCD, PTSD, trauma, generalized anxiety disorder, specific phobias such as fear of flying, needles, blood, things like that. What we do is we look at how these different anxiety responses really get in the way of you choosing behaviors to live your life in the best way possible. So, looking at what thoughts are popping up in different situations and what's going on in your body when experiencing that anxiety, it can be anything from like sweating, getting nervous, turning red. And so, looking at how to use some relaxation techniques along with changing the ways we have perceived threats that are going on so you can really get back to living the best life possible. Working with adolescents with school related stresses such as academics, high pressure sports situation, friendships, and also communication with parents, really exploring how these different stresses impact the adolescent and practicing how to open up and communicate, to share what those thoughts and feelings are to trusted adults, and even teaching parents how to best respond to their teens in these different kind of stressful situations. For young adults that might just be graduating college, there might be a different set of stresses and issues with perfectionist tendencies as they're starting off launching into new careers and the stresses that come with that, along with major life transitions such as getting married, having children, and how to navigate what is going on in their day to day life situations. Working with trauma and PTSD, there's a set of triggers that might come up in different situations where the response that's happening is much more severe than what the actual situation is called for. So, being able to provide a safe place for clients and how to regulate what's going on in their body during those times and really get centered, whether it's dealing with recurrent nightmares, an exaggerated startle response, or unhealthy coping mechanisms. So, really looking at how to reintegrate back into life and having what we call lived experientials so that your brain is feeling more and more safe outside of that initial traumatic experience. I work with clients both in person and also virtually, so really working with your schedule and what works best. If that sounds interesting to you, what I have mentioned in terms of what I treat and work with, please go ahead and give us a call and we will set up a complimentary phone consultation and move forward from there. Looking forward to meeting you.